Good afternoon. Did you all miss us yesterday? We did the same to you. Welcome to Neethu's Academy, reading live with me, Vinod James. How are you all? Yes, what are you all up to? Did you all do the material? Because already you had a day in advance to make sure that you do the material properly. Good. So happy to be back in front of all of you. Okay. So as students are joining, as always, please do let us know if you have any valuable feeds with respect to our live, with respect to anything that you want to communicate to us. Please feel free. And also be cautious as well. Okay, because you are in an online platform, you would be contacted by a lot of fraudulent people. So be aware of such kind of things also. Ramya Gopi, good afternoon and thank you for the flowers. Understand, say please understand there are people who are always like leeches. They try to feed somebody else's blood. So if you are being contacted by any of those people, just report them and put them away. Do not respond to any of those kind of things that they have. One thing, we will not send you messages. We will not tell you any such kind of thing. If you want, you are always welcome to contact the given numbers if you want. That's all. We will not contact you. Praveena Ravi, good afternoon. Rahul Kumar, good afternoon. A very, very, very good afternoon to all of you. Okay. So why we want to make sure that we are very transparent. We don't have anything hidden. We want to be there for you if you are in need of any help. Apart from that, Anju Sri, good afternoon. Jean Maria, good afternoon. So because there are students who have been contacted by people who are here, they are saying, yeah, I am here to make friends. See, you're not here to make friends, isn't it? We know that. That is the reason why Neethu's Academy only have 2 Telegram group only. Okay, why? We have seen that there are a lot of students who are so-called, they are saying that they are students, we don't know. They are saying, do this, we have that, add me in this, add me in this. So what happened? Another student sees that, they also feel that that is there. So that is why we are coming straight to you and saying we only have 2 Telegram group. One, we have just pinned the official Neethus Academy Telegram page, and the other one is an exclusive reading Telegram page. We don't have any other group apart from these groups. So please do not respond to any such unwanted message by anyone. Jinsi, good afternoon. Right, and just a reminder, Neethu Madam is going to come this week, Friday, 10 p.m. Indian time. Please do clock in at the right time so that you will not miss another writing class just for you. Right, and another like we would, on behalf of Neethu's Academy, Neethu's family, we would like to thank all the students who have shown us that abundance amount of trust in us. Because as you can see, the July, August, September batch is closed. You can imagine how much the students trust us, because we have opened our August, September, October batch. Okay, and these are all because of your own trust towards us. Now, why it is important that, just a small advice. See, don't go behind things on the aspect of what others are going to do. You should have an evaluation about what you are. Generally, you should know where you stand. Ramya Rajesh, good afternoon. If I missed your good afternoon, I'm very sorry. A very, very good afternoon to all my lovely students. Tanjarati, good afternoon. After some time, is it? Now, why it is? You should know where you stand with regards to language, because generally a student always follow what others are going to talk about rather than thinking what they are or how much proficient they are. See, if you are in need of an offline class, do not refrain yourself and go for an offline class. If you are ready for an online class, do go for an online class. It can be, see, if you think that your linguistic profile is good, go for a quick class, no problem. If you think that you need some time in order to, do spend that, because do decide wisely. Because or else what happens is not only that you're wasting your hard-earned money, but also you're wasting your valuable time. Just imagine if a person decides, okay, from January I will go for a 3 months course, then by March I'll take my exam, by April or May, the person can reach to that place. Now what happened? Initially one will go from one place to another place to another place to another. By that time, what happened? It is already September to October. And then in between you would have taken number of exams. See how much of money, how much of time you're going to waste. So think wisely. Okay, not about what others are talking about. Right. Soumya Shijo, good afternoon. Manju Merita, good afternoon. Just a suggestion, okay, because we definitely feel that it was something mandatory. That is why we advise you. Because there are students who go behind on the aspect rather than seeing where they are, what others are talking about, they just go and absolutely waste a lot of resources. See, we have to save our resources, think wise, decide wisely. Okay, just thought I would, because I always love all of you on the aspect of, like to make sure that we come there and give you a appropriate guidance. Okay, see, it's not just attending the class over and over again. When you attend a class, you tell, okay, I'll attend to the core, I'll understand whatever that they are saying. Be ready to have that openness. We are not, we have a confined view, certainly. We always expect everything to be in our comfort zone, because mark my words, learning does not happen when you are in your comfort zone. You have to come out of that comfort zone. Okay. Binu George, good afternoon. So just one question before we start today. Anybody who's attending for the very first time, please do let me know that you're attending for the very first time. That's just to show the big time thanks to all the students who have been sharing our link. Because of your share, there are a lot of students who are entering. Not just from one particular country. We have people across the globe. That's why we say English is a universal language, and anybody who's preparing to take the exam can attend this class, because we blend on the aspect of dealing it to universal students, not just about one particular group. Rinsi John, good afternoon. So anybody who's attending for the first time, are England attending for the very first time? Yes, no. So all of you have been here before. So you know what Neethus Academy is, and what are the exams, what are the linguistic exams that we cater for. You can see on the screen we do cater for a lot of different other language exams, and we do make you ready for all those. So if you want to get more insights, you're always welcome to contact the admin. They'll be happy to assist you. Okay, now coming to the Telegram group. One is an official group, as I mentioned, where you will get Chris's listening class every day free. But that class would be in Zoom. So the Zoom link will be posted there on a daily basis in the evening. Every day we have a grammar challenge. Neethu madam's any updates with regards to whatever the exams and whatever the new things that you have to be informed, we'll be informing you there. And the other one is an exclusive reading Telegram group where you get the first-hand information about all the Neethus Academy material. And if you're watching in the very same place, very same page that you're watching, please do not forget to click the like button and the follow button, so that you will not miss any posts that we're posting. Or if you're watching in the very same channel, please do click the like button and press the bell icon. So that is all about us. Mayusha, good afternoon. So I hope most of you have joined. Still, as always, we always look into being that bridge between you and your dream. So we just want to make sure that we take you to your dream country. That's our motto, because together we can. We will not say we can only do. Together we can. Because you are the people who have to do that. We can only be your torchlight. So again, welcome to another session. Are you all ready for today's session? If so, please do give me a very quick thumbs up, and then we will continue. Are you all ready for today's session? Jansi Ratish, good afternoon. Watching from UK. You are one lucky person, isn't it, Jansi? Because all those students who are in here, their dream country is where you are. So you have already reached there. But I know you are also here as a student. So happy to hear that you are from UK. Welcome to Neethus family. Senthil Kumar, good afternoon. Jinsi is ready. Excellent. Good, good, good. Manju Merita is ready. See now, see the diversity. There are people from Middle East, there are people from UK. Priya Sunil Kumar, good afternoon. Anjusri, good, ready. There are people from Nepal, there are people from Sri Lanka, Maldives, there are people from Israel, South Africa, Africa, Ireland. So different places. So it's a multi-diverse classroom. Am I honored by all of your presence? Jean Maria Reddy, Ramya Rajesh Reddy, Rinsi Reddy, Lita Raho. Good afternoon. Jansi Ratish. Thank you. Pleasure, Jansi. So as you all have said, you're all ready. So now what are we going to do? We'll be doing a part B question where you do not have to worry where is the question. The question will be popping on the screen along with the timer. Your job is to make sure that you beat the time. That means finish the finding the answer before time and just send me a thumbs up or say I'm done. Don't write the answers. I'll tell you when to write the answer. Your job is to find the answer, and also when you are writing the answer, tell me where exactly you have found the answer. Priya Sunkumar is ready. Fair enough. As you have said, you're all ready. The question will be popping on the screen. Okay. So as soon as the question pops up, do not waste a valuable second because each second is important. Okay. Do as if you are doing the day's exam. Understood? There you have the question. You can start doing. Okay, time have just gone. I have few who have said yes, done. Mayusha has said done. Excellent. Anjusri has said done. Very good. Tintu Sagar, good afternoon. Done. Okay, fair enough. Good, 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 good. Soumya has done. Okay, excellent. So as you have said, you have done. Would you be kind enough to tell me what is your answer? And the most important thing, how or where you have found the answer. Manju Merita done. Lita done. Good. So please be kind enough to tell me what is your answer. And most importantly, where you have found the answer. Jinsi done. Excellent. പറയാവോ എന്താണ് ആൻസർ എവിടെ നിന്ന് കിട്ടിയ ആൻസർ ശ്രീലക്ഷ്മി ഗുഡ് ആഫ്റ്റർനൂൺ വിദ്യ ഡൺ പ്രിയ സുനിൽകുമാർ ഡൺ രമ്യ രാജേഷ് ഡൺ Manju Matthew C. Okay, fair enough. Amuta Singaraj, good afternoon. So what is your answer? Anju K. Ravindran, done. Ramya Rajesh A. Am I happy? Already I have two answers, A and C. Vidya Srijan, A from third line. Manju Merita, A. Jean Maria, A from last sentence. Okay, now A is popping up. Jinsi, C. Okay, very good. So C and A. Lita, A. Okay. Saumya, A. Jinsi is saying C from first line. Okay. Anju K. Ravindran, A from last. Okay. Tintu Sagar, A from middle. Now why you would have started realizing why we Priya M B. Okay, fair enough. Now A, B, C. So all the three are a possibility of an answer, is it? Shabari Lakshmi, A, new name for me. So apart from one person from UK, none of you have told me that you are new. If you are attending for the very first time, please be kind enough to tell me you're attending for the very first time and where you're from. Right, see the diversity or the way that how we perceive things are very different to how others perceive, isn't it? That's just to show that you have your own rights to say whatever is your answer when you are in with us. Because we want to make sure that we mold on the aspect of from your mistake we have to tackle. See, generally, initially C was there from first sentence, A is from first sentence, A is from middle sentence, A is from last sentence. We know George. See, so why the difference is about how you have read or how you have understood what you have read, isn't it? The overall just remains the same, but how you perceived changed. Now, if you really look into part B, okay, this is after part A, where there is no stipulated period of time. Altogether, you get 45 minutes, where you have to complete B and C. So B being smaller, you're expected to complete the maximum 6 questions. That means 6 questions in total. You have to complete it on or before 10 to 12 minutes. Now the question, okay, part B, the most important thing is about reading the question, understanding the question, underlining the question. Very, very, very important. So here the question is very simple. What is the memo doing? Is it literally doing something? Let's find out. So the question would be popping up on the screen so that you will be able to comprehend it a bit more precisely. So the question clearly says, so do we need to have much of a thing? The question is saying, what does the memo shows, whatever it is. Okay, so my keywords are memo, that is for sure. Memo is the keyword. Okay, now after that you have two options. You can go and read the answer option, underline the keywords in the answer option, and then read the paragraph, or there are students who want to read the paragraph and pick it up. Either way it is fine, but I'm a person who want to know what I'm looking for. So what I'm going to do, I'm going to read my answer option. So option A is saying providing update on success of new guidelines. So my keywords are providing updates. See, the latest or how the most important thing is to make sure that you reduce your number of keywords. See, there is no point of you underlining the whole big sentence. No way. That's not keywords. Okay. So option B, it is saying reminding staff the need to follow. Now, reminding staff is enough. Okay, because follow is understood generally. Okay, so I'm not going to take reminding staff. Or option C, announcing. Okay, guideline or new guideline or introduction, new guideline, new local, whatever you want. Okay, I'm just marking it so that anything is an guideline for you. Now, after doing this, you're literally going to read the paragraph. So what are the paragraphs saying? After a thorough heading is important, administration of antibiotics. So what is the memo about? How to administer antibiotic. This is how you link. You have to always correlate to what you are really looking for. After the thorough analysis and review, our perioperative services, in conjunction with the Department of Surgery and Anesthesia, decided to change the protocols for the administration of preoperative antibiotics and established a series of best practice guidelines. So what has happened? Now, with the third thing, they have changed something. What have they changed? They have changed the protocol of perioperative antibiotics and established a series of best practice guidelines, how to follow. Okay. Now, this has resulted. So, what is this? The change has resulted in a significant improvement in the number of patients receiving antibiotics within the recommended 60 minutes of their incision. So because of the change, what has happened? Okay, so they have changed something. Now they are again reading a preliminary review of the total hip and knee replacement performed in May indicates that 88.9% of patients received their antibiotics on time. Now what are they saying? They have implemented a change. Okay, and this change has resulted in what? Improved significant number of patients. Again, they're talking about some figures. Okay, receiving antibiotics within 60 minutes. So that is a good thing which has happened after the change has happened. And then again, after the review of total hip and knee replacement performed in May, they are giving another thing. 88.9% of people have received their antibiotics because of the change. Now let's go and see how this thing. Now, providing an update on the success of new guideline. So new guideline, already they have implemented a new change. So what are they saying? They're providing an update. Update means they're giving you a statistics on the aspect of their success rate. That means whatever that their change that they have done is benefiting. So slightly, isn't it? Slightly pointing into A. Let's keep it. We are not confirming it. We'll read the next one. Reminding staff the need to follow guideline. Now, is there any reminders happening there? There is nowhere it is reminding any staff that you should follow new guideline. So straight eliminate. Now, announcing the introduction of new guidelines. So this is never to announce the introduction of a new guideline. They are saying, see, because of this, we have changed the protocols. And because of the change, what has happened? We have found significant improvement. And they are giving you a statistics also. So obviously the answer is a very straight answer. Let's go pointing into A. Understood how you got the answer? Is there any doubt with regards to any of the explanation or anything that you want me to clarify any further? Please be kind enough to let me know. മനസ്സിലായോ എന്താണ് അപ്പൊ ഈ മെമ്മോ എന്ന് പറയുന്നത് ഇറ്റ് ഇസ് ടു ഫൈൻഡ് ദി ഓവറോൾ ആ ഗിവൻ പാരഗ്രാഫിന്റെ പേർപ്പസ് എന്താണ് ആ പേർപ്പസ് എന്തായിരുന്നു ഇറ്റ് ഇസ് ടു സേ okay, we had an update and we want to tell you that it is successful. നമ്മളൊരു പുതിയ കാര്യം ചെയ്തു and it is successful. Vidya, okay. Liba, yeah. Tintu Sagar, yes. Soumya Shijo dancing, good enough. Vidya, clear. Lita, yes. Any doubts with regards to any of my explanation, or is there anything that you want me to clarify for you? Reshmi, more clear? Right. So as you're all lovely student with all the capabilities, you never have any doubts, and it's quite a stunning thing because you are able to grab everything on the floor. Good enough. So if you don't have any doubt, shall we go to the next one? What is the next one? We're going to talk about a Part A material which I've already shared. Now, for us to get more insights about how you feel about, it's clear, Mika? Okay, Milka. Amuta Singhara, it's clear, Ramya, clear. Fair enough. Now, what is today's Part A material? And again, a very important thing for all of us in Neethus family is to know how you felt about it. So I want all of you to come and see the commenting. As I've told you, the very first thing that I told you is we have to leave those comfort zones that we are there. Okay, because I always admire a student who has that courage, even though whatever we decide, let's say if it is A, B or C, we say, okay, I got B. You should have that courage to come and say, I got B. Right or wrong is secondary. First thing is to validate, stand by your answer. Have that courage to say, yeah, I got this, and I got this from here, no problem. Because that is where your learning happens. We're all here to learn. Not on the aspect of padikan in the sense to enhance your knowledge. That's what teaching is or education is for. Understood? Hair transplantation. Yes, I know it is hair transplantation. Since he's saying easy, that is what I want. I want your feedback, because by looking at your feedback, we prepare the next material. That means Neethu madam will be eagerly looking at what are you talking about hair transplantation. 90% easy. Okay, I like that proportion. 90%, 10% is challenging. Fair enough. How about others? So easy, 90% easy. This is where I definitely feel that you have to come out of that barrier that you have kept in front of you. You kept a wall saying that, okay, no, I'm not going to come out, because if I come out, what happens if others find me? What happens if others think about? What happens if others know that my answer is wrong? Fair material, Jean Maria. Okay, fair enough, fair material. Right. So, and again, we can only be your slide. Why? Because we can only show you, we can only tell you. But who is the absolute doer? You are the absolute doer. So you have to ensure that, yeah, I have wasted my valuable time just by standing, thinking, going behind. Now, high time. I will start standing on my own. The day that you said that to yourself, the day that you will start seeing significant impact in your life. Mark my words, yeah? Right. Now let's go into the main thing. The question will be, the material will be popping up on the screen. Initially, when you want to do part A, you know what is the strategy. You have to skim and scan. Skimming should be done in 1 to 2 minutes. Okay, the rest 13 minutes, you have to have at least first finding the 20 answers. Okay, do not leave any answers blank. If you don't find one answer, just skip. Go. Finish whatever you can find it initially, then go back and do the ones that you have missed. Right, so what are we going to do in order to do the skimming? See, skimming is very simple because you are expected to underline the keywords. Just go very quickly. You know what are the keywords to be underlined. Go through that. So heading, text, hair transplantation, surgical technique, hair follicles, one part, donor side, bald, known as recipient side, technique is permanent, wellness, minimally invasive procedure, graft containing hair follicle, genetically resistant, balding, so a transplant bald cap, hair transplantation, restored eyelashes, eyebrows, these are all things, chest hair, pubic hair, fillers such as accident, surgery, facelift, blah blah blah. Then they're talking about skin grafting. Graft contain almost all the epidermis, dermis, hair follicles, many tiny grafts, and then single. See why single and all those? These are all numbers. Now I've done with text A. Usually have procedure, doctor's office, surgeon, clean your scalp, inject, medicine, numb back. Doctor will continue 1 to 2 methods for your transplant follicle. FUSSY abbreviation FUE. What is FUSS? 6 to 10 inches in your hair. They are all set aside, closed. The area is immediately hidden, hair rounded. Next surgeon team divides strips into 500 to 2000 tiny grafts. Each individual hair, just a few hairlines. The number and type of the graft depends on your hair type, quality, color, size, and you get in transplant. If you're getting a FOE procedure, the surgeon will have shaved back, and doctor will remove the hair follicles, one from there, the area will be small dots. Hair transplantation can take 4 hours and will be removed in about 10 days. Price, now the whole thing would be about price. It is about $4,000 to $15,000. Time too slow, inflammation, injection, hair follicle called folliculitis, antibiotics, compress, it's watchable, sudden loss of a permanent area, new strands called shock loss, But this is non-permanent, so I'm going to use mirror, few weeks. They can include bleeding, swelling, bruising, crust, and so removed, implanted. Then they're talking about a flow chart, evaluate the presence of miniature hairs, excellent hair loss, participant, advanced disease, signs and symptoms, hyperandrogenism, minoxidil, 5%. Then they're talking about dosage 1 ml twice a day, propecia 1 mg per day, 25 years, surgical transplantation, again 2%, twice daily, 6 months, cryptosterone acetate, evaluate hormone abnormality, negative, positive, herpes surgery, no improved, continue treatment. Now I'm done with my skimming. Okay, now after this, you're going to go to the question. So underline the keywords in the question as well. So question remains a pivotal thing. What are the keywords in the question? What would the consequences be of negative blood? So negative blood, positive blood, where have you seen? So it is negative positivity and all I've seen in text D. So do you have any other doubts about what is the answer? No. Text D. Vital factors that determine the amount and kind of graft. So where are they talking about all these graft and all? I know the answer comes from, usually I have two procedures. So what are they? The number and type depends on your hair type. It's clearly said, isn't it? The type and set and scalp, this and all are there in your hair. So type depends on your hair type. So the answer is B. Very straight. Now, what is the next one? How does the hair transplantation distinguishes skin grafting? Do you really need to worry about skin grafting? We know skin grafting is mentioned in text A. I really don't have to worry about, because all the other places I haven't found that. I can easily say. See, there are people who are being contacted. See, please understand, those are all spammers who have no guts, who is always into somebody else's money. So if you have been contacted by such a kind of people, please block them and report it. They have no purpose to any of you. Okay, absolutely backboneless people who feed. You know who feeds on other people, isn't it? Those are those people. So be aware of it. Excellent. Now for the next question. What can be expected on areas of scalp where hair was removed or implanted? So what expected? So where are we talking about all those things expected? They are there in, what is it expected? A crust forms on the area. So what has that? The answer is C. How long? Now that is enough. How long? Transplantation procedure. Where have you underlined it? I know I have underlined it in B. Why? Because it takes about 4 hours. So what becomes the answer? The answer is B. Now the gender, which more likely, generally a very easy answer, isn't it? What is the gender? So primarily it is a male dominant. Where is that? It is primarily used to treat male patterns. So what becomes the answer? It becomes A. Important medications administered, both sexes. Now where are these both sexes? Male and female mentioned. Male and female are mentioned where? It is only mentioned in male, female, medicine. So answer is D. This is how you start reading all those answers and how you comprehend. Understood? Good. Now for the next thing. See, initially I've told you, you need to be aware of the instructions. 1 to 7 massive following. 8 to 14 short answer questions, where you have to understand these instructions are to be by hearted. Now going into question number 8. Which condition in women may insist them to have an evaluation or hormonal abnormality? So where are they talking about? all these. So women, generally, you know where it is, isn't it? So what are they talking about? Which condition will give them evaluate for hormone abnormalities? Yes. So what is that? Signs and symptoms of hyperandrogenism. So hyperandrogenism is a one-word answer. Understood how you're finding it? So the answer is here. Excellent. Now question number 9. Which inherent nature, that means inborn, hair follicles utilized procedure to get implanted in the back scalp? So where are they talking about all these inherent and all those things? So where are they talking about genetically? What are they saying? Genetically inherent. What is that? Resistant to balding. So it's a 3-word answer. Resistance, RESISTANCE or tint to balding, BALDI. Question number 10. Which method of hair plan get back to your scalp shape? You really never worry about which, because the heading, we know that you have types of procedure mentioned where? In B. Now where is it only talking about scalp being shaved? It is under FUE. Understood? Because it will shave your back. Excellent. The condition developed post. So condition developed post to the implantation, causing swelling and infection of the hair follicles. Where are they talking about? What is the condition? We have already underlined it. What is the condition? Around this time, the new lock starts to grow. Some people have inflammation or an infection from the hair follicles called folliculitis. It's not follicular extraction. It is, the condition is called folliculitis. Excellent. Good enough, good enough. What is the least number of graft produced out of strips of skin? So I know that least number of graft where? It is clearly mentioned in, where are they mentioned? It's clearly mentioned in text B. What is the least? Now the next problem is least. So the least is 500. So it's a number 500. Age to be surpassed by men in order to prefer surgical intervention. So where are they talking about the age? Surgical intervention. Where are they saying surgery, surgical intervention? If older than 25 years. Now 25 years is supposed to be your keyword. Why? It's a number. So the answer is 25. Why? Years are already there. Or you can write 25 years. No problem. Because age only is there. So 25 years is the answer. Good enough. Now the 14th question. Which part of body to which removed hair follicles are placed? So part of the body, what is that called? It is called the recipient site. It's to the bald or part of the body known as the recipient site. So which is the part of the body to which the hair follicles are placed? It is known as the recipient site. Okay, good enough. Now question 15 to 20. Fill in the blanks. Instruction should be as by-hearted as ever for all of you. Now, dash can be administered to men without finasteride in a dosage of 1 mg. So where have you done 1 mg and all those things? It is there in text B. Now what should be the answer? The answer is minoxidil 5%. MINOXIDIL. 5% can be administered. So even minoxidil is okay, even if you have, but the 5% is because of the strength which has been spoken. Why? Because there is a 2% strength for others. So that is why minoxidil 5% should be written. Good enough. It is usually the dash and dash relieves infection, inflammation develops. So what are they talking about? Where do you get the answer from? You get the answer from C. Why C? Because that is where you're going to get. What are the things that is going to cause you? Give you antibiotics and compresses. So first one is antibiotics and the second one is compressors. Excellent. Question number 17. Once the back of scalp gets shaved, so where is scalp gets shaved? You know where you should be finding this answer, isn't it? Remove the dash, one by one, get healed. So scalp one by one. So yes, I know that it is there in B. So what are they saying? Shaved. Then the doctor will remove hair follicles one by one. So it's a two-word answer. What is the two-word answer? It is hair follicles. HAIR FOLLICLES. Excellent. In a follicular unit strip surgery, surgeon removes dash strip of skin from the back of your head. So where are they talking about? In a follicular. So where are they talking? Again, it should be somewhere because it is there with first the surgeon removes 6 to 10 inch strip of your skin from your back of your head. So what is that? 6 to 10 inch. Number 6 to number 10 inch. INCH. Penultimate question for today. Spirolactone or DANS would be better treatment option if signs and symptoms of hyperandrogenism remains unimproved over years. So where do we need to look for? Do we need to look for anywhere else? No, it should be there in text D. So it is there. It is in female. So add the other first keyword is there. So what is the next one? Cyproterone acetate. So CYPROTERONEACETATE is the answer because all the other keywords are as such there. Improved after 6 months to 1 year. So there you have the keyword. Now the ultimate question for today. The recipient of graft may have where suddenly loses some of the original hair and get new strands. So where are they talking about all these? It is there in text C. Why? It is saying it is also possible to suddenly lose original hair, get new strands called shock loss. SHOCKLOSS. So I have wrapped my 20 answers. I have fired all my 20 answers. Now it's high time that you start firing. If you have any doubts, please ask me. If you want to clarify anything, please ask me. If not, please do give me your total score. 18 Sri Lakshmi, very good. Keep it up. How about others? What are your scores? Tell me. And see, when you're doing the material, Jean Marie, excellent. 20 out of 20. Very, very good. Fantastic. Jinsi, 19. Very good. Keep it up. Soumya, 18. Very good. Excellent. See, you have to be genuine to yourself. Even if it's the smallest spelling error you make, be happy to mark it wrong so that you will learn from your mistake. Vidya Sujin, 18. Good enough, good enough. Soumya, thank you. Pleasure as always. As how about others? എന്തെങ്കിലും doubt ഉണ്ടോ? Clarify ചെയ്യാൻ. Soumya, thank you for the flowers. Anything that you want me to clarify? I know the material was easy. Almost everything was a straight answer. Right? Almost everything was a straight answer. 13th answer. Age surpassed by age in order to prefer them for surgical intervention. So surgical intervention means surgery. Where are they talking about? It should be surpassed 25 years. So that is there in text D in the flow chart. Men. Where is men? Men is there in men and women. So what is the age for surgery? Surgery is. That's how you refer keywords. See, part A is purely about referring keywords. You should know what are the keywords, then match it. Why not? Older than. Surpassed is older than. Surpassed means older. That's why. 25 years. And the question is only asking the age. Understood? Yes. Are you clear with that, miss? Because the question is asked, it's already asking surpass. So that is why older than is not needed. Clear? I hope it is clear. Since you don't have any doubts, any other doubts? No. So we'll be seeing you tomorrow. Until I see you tomorrow, adios from all of us. Stay blessed. Take care.